If you're having surgery and you're in a teaching center where there are interns and residents, who do you think is going to do your surgery? Can you be sure that the doctor that you went to see, who's your private doctor, is going to do that? Or do you think that maybe it's possible that you will not be informed and a resident will be doing some of the surgery or maybe all of the surgery that is in your particular case? I'd like to think that if I'm going to see somebody and I have a relationship with that person is going to do the surgery. And I would be horrified if I thought somebody in training was going to be doing that procedure for me. And yet at the same time, we've got the problem, how do we teach residents and interns how to become doctors who are qualified to do surgical procedures? That's the rub of what we see in teaching centers. An article published in the Archives of Ophthalmology in July of 2012 showed that in a study where they sent out 117 letters to directors of ophthalmology programs, 53 responded, and of those, only 14 said that they informed patients that their surgery might be done by a resident. Wow! Talk about unethical to my point of view. I think the patient always comes first, and the integrity and honesty of what's going to happen is every bit that person's right to know. And to me, it's outrageous not to have a patient get what they think they're getting. If I thought for a minute that I was going to a doctor who was a great surgeon and that he wouldn't be doing that surgery and someone else would be doing it, and it was a very technical operation, which many of them are very complicated, that to me would be stunning. Now, I can understand if you went to a teaching hospital and they told you that if you come to this particular hospital, you will have a resident who will be assisting the surgeon and in some cases even be doing the major part of that operation. That would be different because then you have a choice. You may want to go there and you may not. And in some highly specialized areas where surgical techniques are very complicated, we do have to teach residents how to do that. And if it's done with a lot of supervision, care can actually be better. Because you've got interns and residents and fellows, and then you've got the actual doctor, the surgeon, who is in charge of that whole procedure. And there are people around all the time who can be available to see you in a moment's notice. There's some value to that. There are checks and balances that follow that. But supervision is very important. When it comes to the surgery itself, however, if I'm having a surgery done someplace in a teaching center, I'm going to ask that physician, will you be doing the surgery or will this be done by a resident? And if it's a complicated operation, that's one thing. But even if it's an operation on your eye that's a simple operation like a cataract extraction and lens implantation, if that goes wrong, you can't see right. So for me, I think that I would want to know. Unless we change what we inform patients about, I think that would be unethical to do things like bring on surgeons that are in training to do your operation when you have no idea that's happening. So if you're going to be having an operation in a teaching center, ask your doctor who will be doing the surgery.